For those that may be unfamiliar with Mercy Community Health, give us a little bit of history.
So our history goes back 20 years, so I won't go through it all, but basically in 1999, God put on a pediatrician's heart, his name was Tim Henschel, just a desire to help an underserved population in the Franklin area. And so there's some local churches involved and a number of events that happened that led to the foundation. And at that point, it was serving a pediatric population and did for a number of years until about 2012, 2013. The board at the time felt led to expand care to adults. And our CEO at the time, David Winningham, had helped a Christian clinic transition to a federally qualified health center to have federal funding in order to provide and expand their services. And so through his leadership, we ended up applying for and received federal funding, and that helped us to expand to see adults. So right now we see both the pediatric and adult populations and have been doing so for about 7 years now. We also have really expanded our mental health services, and so we have a team of psychiatrists, psychiatric nurse practitioners, counselors as well that serve with us.
And what is the mission of Mercy Community Health?
So our mission is to serve all in the name of Jesus Christ. And so we're faith-based, but we serve the entire community. We do have an emphasis on the uninsured and underserved, but we see all patients as a community health center. And we provide primary care services. We do see acute visits as well for sick visits. As I mentioned, we have psychiatric and counseling services. And we continue to provide care for a pediatric population with pediatricians and pediatric nurse practitioners.
Can you tell me a little bit about the need in Franklin and Middle Tennessee as a whole?
Sure. There's a large need. We do serve not only the Franklin community, but even to communities and counties beyond. And so the need is great in Middle Tennessee and in Franklin. As I had said, we initially started for a pocket of underserved and uninsured people in Franklin, in the Franklin community. But we do provide care for all people, and we have recently expanded even into the school system. So we have had a number of counselors in the schools helping students in our community. Of course, during this COVID-19 outbreak, that particular program has been furloughed and on suspension until schools reopen. And so, but that is another way we've been serving the community.
And as an organization that's providing healthcare to folks in Middle Tennessee, how have you guys had to adapt and adjust during this time?
So the big change has been with our protocols. So making sure that our patients are safe, that's our number one priority in all we do. And so making sure that we have space that is separate for well versus sick patients, developing protocols before patients even enter our facility for how to address sick patients, making sure that we have the equipment, and you've heard a lot in the news about the PPE, the protective equipment, enough of that available, and we've had a lot of support in the community and other resources helping to provide for that. So a lot of it is surrounded just making sure we have a safe place to continue to provide well care. So we are doing more and more primary care now as things have opened up more, but also for our patients who are sick in the community to keep them safe, and also the other patients that are coming to see us. So a lot of it is surrounded protocols and making sure we have a safe environment to continue to do what we're doing.
What are some ways that the community can come alongside you guys to help during this time?
So I think one of the big things for us, particularly as a faith-based organization, is prayer. So praying for protection, safety for our staff and patients, particularly. We are undergoing also a building campaign. Right now we have administrative and counseling services at separate locations in the same center within a walking distance. But so funding donations is always a big help. As far as other opportunities, we do look for volunteers. So certainly through our website, which is www.mercytn.org, get on the website, see some of those volunteer opportunities, or inquire for how they can help. And we have people that can reach out to them to tell them how they can help us more specifically, especially during this time.
Wonderful. In closing, what puts a smile on your face when you think about the impact that you're making through Mercy Community Health?
I love what we do. I love the fact that we can provide and help anybody that comes through our doors, even during difficult times like this. That's what keeps me here. I've been here for 12 plus years and love what we do. We're here to serve the community, serve patients, whoever you are. And I love that fact. And it is a blessing being in healthcare during this time of need, being able to provide for people when they really need it as well. So I'm thankful. I'm thankful to be working with Mercy, thankful to be doing what I'm doing.
Well, Dr. Brunner, thank you so much for all that you do for our community and for powering the good.
Thank you. Thank you very much, Meredith.